I mean, I don't know that anybody expects to hear the words, "you have cancer." It caught me off guard.
Marilyn Bray has never missed her annual mammogram, so the results of a screening 2 years ago were devastating. Doctors found 3 tumors, 2 different types of cancer in both of Marilyn's breast.
Time stopped. It was very still for a moment, and I looked at Dr. Keller and said, "What does this mean?"
Dr. Nicole Gallagher, director of breast imaging at Johnston Willis Hospital, says a 3D mammogram helped catch Marilyn's cancer in the early stages. A follow-up ultrasound and MRI confirmed that the cancer, which showed no outward signs or symptoms, was in more than one place.
What 3D mammography does for us that 2D mammography couldn't do is it allows us to actually scroll through the slices of the breast tissue and separate out the tissue planes. Any cancers that might be hiding amongst those tissue planes are separated out, and we're able to see them more clearly.
3D mammograms create a 3-dimensional picture of the breast, helping radiologists detect cancer in patients who have no signs or symptoms. It can also be used to determine the cause of breast problems, such as breast mass, pain, and discharge. 3D mammograms not only help reduce the need for follow-up imaging, but improves breast cancer detection in dense breast tissue.
The whole goal of screening mammograms is to find cancers when they're a centimeter in size or smaller, because survival is directly linked to tumor size at the time of diagnosis.
Marilyn immediately started chemotherapy and radiation. As the only caregiver for a younger brother with special needs, she says support along the way has been very important.
Yet, anybody there you ask a question, they're so helpful and very caring, very compassionate. It's just such a positive environment at a very vulnerable time for us patients.
Marilyn has since written a book hoping to inspire others to get screened.
Find a support system to help you get there. It's imperative that we take care of ourselves because the consequences are harsh.
It's recommended that women start getting breast cancer screenings at the age of 40 and every year after that for the rest of their life. Women with a family history of breast cancer should have an annual mammogram starting no later than 10 years before the age of the earliest diagnosis in their family. Working for your health, I'm Tracy Sears.